Hi everyone, a blessed day to all. Praying that all of you are safe and doing well together with your families and loved ones. May God continue to guide you as you walk in this journey of nursing profession. May you become nurses with a brilliant minds, a good clinical eyes, a heart that truly care, and a hands that heals. Remember that nursing is not an easy profession. It is a tough profession that requires a huge brain, an enormous heart, a skillful caring hands, and a tons of patience. Sometimes you feel down, tired, suffocated, and even frustrated. Yet, it is the most rewarding and gratifying profession. So never give up. Just pray, do, and give your best, and God will do the rest. Before we proceed to our main topic in this presentation, let me first share to you this disclaimer slide. Please note, no copyright infringement is intended, and I do not own or claim any images, designs, and any of the original information stated and used in this video. And this is used for educational purposes only. If any content owners would like to dispute this, I will not hesitate to immediately remove the said content. If you happen to find your art or images in the video, please let me know and I will be glad to credit you. Here is my email, aubrey.tairit@cjhc.edu.ph. In this video presentation, I will talk about nutritional and diet therapy for patients with gastrointestinal disease. So this is the outline of this presentation. So as mentioned, we will talk about the nutritional and diet therapy for patients with gastrointestinal disease, particularly those patients who have gastritis, lactose intolerance, diarrhea, constipation, hemorrhoids, hepatitis, and cholelithiasis. For you to understand better about gastrointestinal diseases or disorders, let us have a review first about your anatomy and physiology of your gastrointestinal system or your digestive system. It is composed of multiple organs that starts from the mouth or your oral cavity down to the anus. The digestive system breaks down food from the mouth and liquid into essential substances, and then it extracts nutrients and absorbs energy, and then excrete undigested waste through your anus. The GI tract or the gastrointestinal tract is made up of two distinct tracts, the upper and the lower gastrointestinal system. The upper gastrointestinal system includes the mouth, the esophagus, the stomach, and the small intestine. On the other hand, the lower gastrointestinal system includes a portion of your small intestine, the entire large intestine, and the anus. Remember also that the gallbladder, the liver, and the pancreas also play an important supporting role to the gastrointestinal system. They are commonly referred to as accessory organs. There are two main types of gastrointestinal diseases or disorders. These are the functional gastrointestinal disorders and the structural gastrointestinal disorders. So the functional gastrointestinal disorders or FGITs occur as a result of the GI tract functioning abnormally. Though the actual structural integrity of the GI looks normal upon examination and testing. On the other hand, the structural gastrointestinal disorders occur due to an abnormality in the GI tract and when an organ or the internal structure is not functioning properly. These structural abnormalities are discovered during X-rays, computed tomography scans, blood and urine samples, and during endoscopy or colonoscopy procedures. The functional gastrointestinal disorders are commonly characterized by recurrent and or chronic symptoms associated with the abdomen or bowel habits, including the three most common features, such as motility, which refers to the GI tract's muscular activity. The second one is sensation, which refers to the nerves' responses to stimuli, and the brain-gut dysfunction, or there is a disharmony between the brain and the GI system. So this includes diarrhea, gas, bloating, nausea, irritable bowel syndromes or IBS, constipation, and gastroesophageal reflux disease or your GERD. So the GI system is so complex, and of course the symptoms vary from person to person. So therefore, for this type of disorders, there is no single treatment or single strategy that is effective for everyone. However, the healthcare professionals typically customize treatment options comprising specific recommendations that includes changes to lifestyle and diet, and of course exercises. Aside from that, of course, there will be pharmacological treatment. The structural gastrointestinal disorders, the usual symptoms includes or can be similar to the FGIDs, but may also be more severe and include significant and prolonged changes in bowel habits, or there would be obstructed bowel movements and even rectal bleeding. The following are your gastrointestinal disorders such as your hemorrhoids, colon polyps, colon cancer, Crohn's disease, and inflammatory bowel disease. So unlike FGIDs, the SGIDs typically involve a more in-depth diagnosis and treatment, and often require surgical procedures to rectify and treat the problem. If the serious SGIDs go unaddressed, the symptoms are likely to worsen and other complications may begin to arise. Another GI problem is what we call lactose intolerance. So this is caused by a deficiency of lactase, which is the enzyme needed for digesting the sugar in the milk. This undigested lactose remains in the small intestine and may serve as a substrate for bacterial fermentation. There are two types of lactose intolerance. These are the primary lactose intolerance, which usually due to congenital lactase deficiency or adult lactase deficiency. The other one is secondary lactose intolerance, which arise from other disease conditions. The diet therapy for lactose intolerance include lactose-restricted diet, which is prescribed for patients to manage the pain and discomfort that is caused by flatulence, bloating, or diarrhea. This type of diet includes lactose-free milk, fruit juices, graham crackers, rice and pasta, soy milk, plain meat, fish, poultry, oatmeal, vegetables, and fruits. Another GI problem is diarrhea. I'm sure this is not a new term to you because almost all of us had experienced this type of gastrointestinal problem. So it refers to a passage of stools of liquid to semi-solid consistency at frequent intervals along the digestive tract, effectively preventing complete digestion and absorption. So there are two most common categories. The one is acute diarrhea and the other one is chronic diarrhea. To differentiate between the two, acute diarrhea is a diarrhea of less than 2 weeks that is caused by viral, bacterial, or protozoan infection. Also, medication side effects or altered dietary intake can cause diarrhea. So, the chronic diarrhea refers to a diarrhea that lasts for more than 2 weeks from disorders like malabsorption or due to medical treatments complication. For the diet therapy, particularly for patients who had diarrhea for several days, the patient must be placed on NPO for 12 hours with IV fluids and electrolytes. Of course, that is to prevent further dehydration. And if the patient is allowed to have oral intake, the patient must be given liberal intake of fluid that contains, of course, high in potassium. You can get high potassium drinks through broths and electrolytes. And then the patient must avoid harsh fiber because this can irritate more your GI tract. And then you can give the patient oral rehydrations. There are a lot of over-the-counter ORS. However, in the absence or if you're far to a drugstore, you can have your homemade or ORS or oral rehydration by combining the following ingredients. You can have 3/4 of teaspoon salt plus 2 teaspoon baking soda and a cup of orange juice plus 4 tablespoons of sugar and mix it in a 1 liter of water. Now you have your oral rehydration. And the patient must be advised also to have bland diet. So bland diet is a type of diet that has no flavor at all. And advise them to have small, frequent meals. That is to allow the digestive tract to rest between meals. And then, of course, you have to eliminate known GI irritants. And the patient can also have broth diet. So broth diet means a banana, rice, applesauce, and toast. This is a widely used treatment of diarrhea, particularly in pediatric clients. You can also give yogurt to your patient. Another problem is constipation, which is opposite to diarrhea. And I know, again, this is not a new term to all of us. There are 3 types of constipation. The first one is atonic, which is a condition usually experienced by older people, obese individual, and those patients before abdominal or gastric surgery, and those pregnant women. This is due to too much pressure being placed in the GI tract. So, this is sometimes called lazy bowel. There is a loss of rectal sensitivity and an urge to defecate is lacking. The feces are huge and stiff. The causes includes irregular meals, lack of liquids and fiber, and irregular defecation. Another type is spastic, that caused by an overstimulation of the intestinal nerve endings, which results in irregular contractions of the bowel. The causes are extreme use of cathartics, laxatives, tobacco, tea, coffee, and alcohol. Also, stress, poor hygiene, lack of fluids, and irregular defecation can cause spastic constipation. So another one is obstructive, that wherein this is a condition in which the passage of the feces is impeded or there is a compression by surrounding tissues that happens, causing the drying and enlargement of fecal mass. For the diet therapy, the patient must be advised to have high fiber diet with at least 20 to 35 grams per day of dietary fiber and a combination of soluble and insoluble fibers. The patient must be also advised to have increased fluid intake, and for those who have obstructive type of constipation may be advised to have low residue diet. Moving on to another GI problem, we have gastritis and peptic ulcers. Gastritis is the inflammation of the mucosal surface of the stomach. This can be acute or chronic inflammation. It can range from mild asymptomatic form to severe ulceration, which, if untreated, may lead to perforation. So the peptic ulcers include lesions in the stomach and the duodenum. And 80% of gastritis and peptic ulcers are associated with Helicobacter pylori infection. So as mentioned, there is an erosion of mucosal layer and of course tissue damage. And then there will be exposure of cells to gastric secretions and bacteria. These are the causative factors of gastritis. This includes bacterial or viral infection, stress, heavy smoking, alcohol use, caffeine, and improper diet that includes spicy and greasy foods. All of this can increase the acid of your stomach. So as mentioned in the previous slides, the main causes of gastritis is the Helicobacter pylori or H. pylori, which is a bacteria that is resistant to acid. This can cause damages to the mucosa, and this can be treated with bismuth, antibiotics, and anti-secretory agents. So Helicobacter pylori causes 92% of duodenal ulcers and 70% of gastric ulcers. So this is an image of gastritis in the normal mucosa of the stomach. Okay, so gastritis, there is already an inflammation of the mucosal lining or the lining of the stomach. So this can be seen or viewed via endoscope. Okay. So this is a picture of peptic ulcer disease that affect the duodenal ulcer and then gastric ulcer. So again, peptic ulcer is an ulceration in the protective inside layer that can affect the lower esophagus, the stomach, or the duodenum. The signs and symptoms of gastritis includes anorexia, nausea, vomiting, malaise, belching or gas, or there is a feeling of fullness and epigastric pain, or there will be occasionally fever and diarrhea. So this is just an image of the signs and symptoms of gastritis. Again, burning, nausea, vomiting, hiccups, and bloating. So for the diet therapy, the patient must be placed on NPO or nothing by mouth for 24 hours and then gradually shift into soft diet. And the patient must limit or avoid the following: milk or cream, alcohol, fruit juices and soft drinks, coffee, regular and decaf, red and black pepper, because this can cause again an increase in the acid of the stomach. So the dietary treatment for peptic ulcers requires a preparation of blunt diet as well. Blunt diet is a nutritionally adequate diet that includes food that has a blunt flavor and soft consistency. Moving on to another GI problem, we have ulcerative colitis, which refers to an inflammatory bowel disease of the large intestine limited to rectum and the colon, which causes profuse and bloody diarrhea. Other signs and symptoms include severe diarrhea, rectal bleeding, cramping, abdominal pain, anorexia, and weight loss. So this is an image of ulcerative colitis. Again, ulcerative colitis is a long-term condition where the colon and the rectum became inflamed. The colon is the large intestine, or known as the bowel, while the rectum is the end of the bowel where the stools are stored. Small ulcers, as you can see in this image, can develop on the colon lining, and this can cause bleeding and can produce pus. For the diet therapy, the patient must be advised to have high protein diet with at least 120 to 150 grams of protein, high calorie diet with at least 2,500 to 3,000 kilocalories, and increased vitamins and minerals, and the patient must be placed on low residue diet. Another GI problem is Crohn's disease, which is a type of inflammatory bowel disease that causes swelling of the tissue or inflammation in the digestive tract, which can lead to abdominal pain, severe diarrhea, fatigue, weight loss, and malnutrition. So these are the risk factors of Crohn's disease. It could be due to familial tendency. The peak age is between 15 to 40 years old, and it is autoimmune factors. Okay, the patient may also experience abdominal pain and distension, and there will be tenderness in right lower quadrant. For the later signs and symptoms, the patient may have dehydration, electrolyte imbalance, and anemia. So those are the complications for untreated Crohn's disease. It can cause intra-abdominal abscesses, intestinal fistulas, peritonitis, and even development of fistulas. So just another image of Crohn's disease, wherein this part, the red parts are the inflamed areas. For the diet therapy of patients with Crohn's disease, they must be placed on a low residue and low roughage diet. So when we say roughage, this refers to fibrous indigestible materials in vegetable foodstuffs, which aids the passage of the food and waste products through the gut. So this includes citrus fruits, apples, peas, barley, psyllium, and oat bran. Those are digestible fiber. For the non-digestible fiber, this can be found in foods such as wheat bran, whole wheat flour, nuts, and whole grain foods. And the patient must have a bowel rest with alternate feeding method, so small frequent meal. And then increased fiber and decreased fat intake may help relieve the symptom. Another GI problem is hemorrhoids, which refers to the enlargement of the veins which occur in the lower part of the rectum at the anal opening. There are two types of hemorrhoids, the internal and the external hemorrhoids. To differentiate between the two, the external hemorrhoids crop up when the rectum meets the skin, while the internal hemorrhoids form completely within the rectum. The causes include childbearing or during pregnancy, constipation, hepatic cirrhosis, long use of cathartics and enemas, lack of fiber, and diet high in sugar and fat. So in this image, you can see the difference between the internal hemorrhoids and the external hemorrhoids. However, in this image, there is already a prolapsed internal hemorrhoids. And then, of course, both of these could be painful. The signs and symptoms of hemorrhoids includes bleeding, itching, and pain. For the diet therapy, the patient must have high fiber diet with at least 25 to 35 grams per day, and advised to have increased fluid intake with at least 8 to 10 glasses of water per day. And highly seasoned foods and relishes are to be avoided. For patients during a flare-up, they must be placed on low-fiber diet. This is another image of internal hemorrhoids and the external hemorrhoids. So this is a different picture from the previous slides, wherein the internal hemorrhoids has prolapse. Here, hindi pa siya nag-prolapse. So, this is painless. On the other hand, the external hemorrhoid is, since it is located outside, this can be very painful. Moving on to another GI problem, we have gastroesophageal reflux disease, hiatal hernia, and esophagitis or heartburn. This can take place 1 to 4 hours after a meal when there is a decrease in the sphincter pressure that happens. The causes include increased levels of progesterone during pregnancy, use of oral contraceptives, smoking, and eating of certain foods such as chocolates, soft drinks, citrus fruits and juices, and caffeinated drinks. For the treatment, the focus is on reducing intra-abdominal pressure and gastric acid production. The diet therapy includes avoiding foods that are high in fat, avoiding large meals, and limiting food that relax the lower esophageal sphincter. So another GI problem is hepatitis. This refers to the inflammation of the liver with necrosis of the liver cells. The clinical symptoms include fatigue, nausea, anorexia, right upper quadrant pain, dark urine, and elevated levels of ALT or aminotransferase alanine. There are different types of hepatitis: hepatitis A, B, C, D, and E. To differentiate, hepatitis A is caused by a virus transmitted by the fecal-oral route, usually through ingestion of contaminated food, particularly street foods, or with anal or oral sex. So you have to be very careful. Hepatitis B, on the other hand, is caused by a virus that can cause both chronic and acute hepatitis. The known transmission of this type of disease are through blood transfusion, tattoo application, sexual intercourse, contact with blood or bodily fluids, or via the mother to her child by breastfeeding. However, the source of infection cannot be determined in about half of the cases. Blood contact can occur by sharing syringes in intravenous drug use, lalo na sa mga drug users, shaving accessories, or touching wounds on an infected person. Hepatitis C is caused by a hepatitis C virus with an RNA genome that is a member of the Flaviviridae family. It can be transmitted through blood contact or sexual contact and can also cross the placenta. Hepatitis C may lead to a chronic form of hepatitis, leading to a scarring of liver called cirrhosis. It can remain asymptomatic for about 10 to 20 years. So, the hepatitis C patients are susceptible to severe hepatitis if they contact either hepatitis A or B. For hepatitis D, this is caused by hepatitis delta agent, which is similar to a viroid. This type of disease can only propagate in the presence of the hepatitis B virus. Thus, a person can only get this type of hepatitis if he or she is already infected with hepatitis B. Okay, so hepatitis C actually produces symptoms similar to hepatitis A, although the process can be fulminant in some patients, particularly among the pregnant women. It can cause swelling of the liver without long-term damage. A person can get this type of hepatitis by drinking water infected with the virus. It can also spread through oral and anal contact. The diet therapy for hepatitis includes the following. So the major goals is for liver regeneration, prevention of further injury, promoting organ rest, and prevention or correction of the weight loss. The patient must increased calorie, increased protein, and increased carbohydrates and moderate fat diet. They're advised to have small to moderate portions of mealtime with between meal supplements of high protein beverages. So again, the hepatitis patient should have increased protein with at least 1.5 to 2 gram per kilogram. And you can provide at least 40% of the kilocalories as the CHOs to promote glycogen synthesis and spare the protein. The patient can have moderate fat with at least 80 to 100 grams daily. They are placed on high-calorie diet with at least 3,000 to 3,500 kilocalories or 30 to 35 kilocalories per kilogram of body weight. The patient with fever or without fever rather can have 2,000 to 2,500 kilocalories. And for patients with fever, they can have 2,500 to 4,000 kilocalories. They must be advised to have vitamins and minerals, particularly zinc and B complex. Another problem, or actually this is a complication of hepatitis, particularly hepatitis C, we have cirrhosis, which is a chronic degenerative disease in which there is the buildup of fibrous connective tissue replaces the liver cells following fatty degeneration of long standing. This condition can contribute to further decline of the liver's function. It can cause the liver cells to die and form new cells, and scarring, which can lead to congestion of hepatic circulation. For the diet therapy, particularly for patients with severe cirrhosis, they must have sodium restricted to 250 milligrams, and then protein intake of 100 grams at sodium level of 250 milligrams is possible when low sodium milk on the 500 milligrams sodium. And the patient can have at least 1,800 kilocalories diet. Of course, the patient should be advised to avoid alcohol. Another GI problem is gallstone diseases, wherein the stone develops in a sluggish diseased gallbladder. There are two types of stones, the cholesterol stones and the pigment stones. The cholesterol stones form when the cholesterol in the bile gets too concentrated due to too much cholesterol synthesis or decreased bile synthesis. On the other hand, the pigment stones form as a composite of bacterial microcolonies and pigment solids. The formation of stones in the gallbladder may be due to infection, stagnation of the bile, changes in the chemical composition of the bile, and due to overeating, laging nagsasamgyupsal, or eating habits. So these are the different types of gallstone diseases. We have cholelithiasis, which is a combination of infection and stones in the gallbladder. Cholelithiasis, there is a formation of gallstones without infection, and the other one is cholelithiasis, wherein there is a development of stone slips into the common bile duct, producing obstruction and cramps. So this is the image of patient with cholecystitis or inflammation of the gallbladder. The patient may have fever or leukocytosis, or ibig sabihin nito, there is an increase of WBC. The patient may have jaundice or yellowish of the skin or sclera. The patient may have nausea and vomiting, anorexia, fat intolerance, feeling of fullness, and abdominal distension. There would be a pain, particularly right upper quadrant pain or right shoulder pain, may radiate to back, and this type of pain can increase with deep breath. So this is the image of cholelithiasis, wherein there is a formation of stone within the gallbladder. This is the cholelithiasis, wherein the stone slips into the common bile duct. And hepatolithiasis, there is a formation or the stone slips into the small bile duct. The diet therapy for patients with gallstones diseases includes the following. The patient must have low-fat diet, high-fiber diet, protein and carbohydrate intake is kept in normal requirement. Plain and simple foods are recommended. Spices and high residue foods must be avoided. So, rich pastries, chocolates, nuts, and fatty, fried, and gas-forming foods should be avoided. Another GI problem is pancreatitis, which is a condition that may also result from biliary tract disease in surgery or due to alcohol abuse and gallbladder diseases, wherein there is an inflammation of the pancreas due to a decreased production of the digestive enzymes. There are two types of pancreatitis. Number one is the acute pancreatitis, which is commonly caused by excessive alcohol intake and gallbladder disease. The patient often experiences pain, nausea, vomiting, and diarrhea. So, again, acute refers to autodigestion, originates from obstruction of the pancreatic duct. On the other hand, the chronic type of pancreatitis is characterized by chronic pain and abdominal distension. This type of pancreatitis or conditions can result in permanent damage to pancreas. The diet therapy during acute attacks, the patient must be placed on NPO, again, nothing by mouth, for 48 hours. The patient should have low fat, low elemental formulas when enteral feeding is appropriate. In chronic cases, the patient must have low to moderate fat, high carbohydrates, and moderate protein diet. Fluids and electrolytes must be given intravenously. The patient are advised to have 6 feedings daily to facilitate adequate nutritional intake. That ends our topic on nutritional management for patients with gastrointestinal disorders or diseases. And these are the references of my presentation. Thank you everyone for listening and watching this presentation. I hope you learned a lot. This is the end of our discussion. God bless everyone.